Hello everyone, this is Cantor Gaston Bogomolny and broadcasting from TAL Community Mental Health Center. TAL is transformation, affection, and love. Today we are going to have an amazing guest. Today we're going to be talking about one of our support groups, one of our empowering life groups, which is the Postpartum Depression. What does it mean, Postpartum Depression? It is related specifically to those women who have had just gave birth, and then scientifically and evidence-based show that there's a minor depression when the women have delivered a baby, after the pregnancy, and that's exactly when they get this specific depression, mini depression, but it's still depression, and it's called postpartum, from delivery. So we're going to have our specialist, which is Myriam Ayala, LCSW, licensed clinical social worker, who is going to be talking to us and telling us about the support group that TAL is offering and that she's going to be facilitating, and also explain and give us some information about what it means to have postpartum depression, how we can work the conditions of that, how we can heal, how we can treat it, and treatments might go from going to support groups. Treatments might go by also having individual therapy as well. So we are waiting just in case. If you don't know who we are TAL Community Mental Health Center. It's the first integrative healing center that combines both the conventional therapy as well as the holistic and also the alternative therapy. We are located in North Miami Beach, 1400 Northeast Miami Gardens Drive, Suite 216. If you want to call us, you can always call us and give us a nice call, and to 786-648-3588, or you can also write us an email to info at talcmhc Community Mental Health Center.org, or you can go to our website www.talcmhc.org, and you can always tell us what you think. If you want to have a 15-minute free appointment, you can have a mini intake. There are many different ways, and I'm going to invite now to my co-partner, who is Marcela Gomez Bogomolny, and let's hear. They need to ask us. There you go. A request for Gomez Bogomolny. It's going to take us just a few seconds, and she's going to be live with us. Hello, you're live. This is Marcela Gomez Bogomolny, and you can introduce yourself as we wait for Myriam Ayala, our LCSW, who's going to be our facilitator for the support group for postpartum depression.
Okay, good evening, everybody. Hola, ¿qué tal? Esta es Marcela. This is Marcela Gomez Bogomolny. We are TAL Community Mental Health Center. And as you know, we've been inviting the people who's going to be given the therapies and the support groups. And tonight we have Myriam Ayala, who is a licensed clinical social worker, licensed in the state of Florida, but also she's licensed in the state of New York. Myriam is not only a excellent therapist, but also she's a Latina, habla español e inglés, so her therapy will be in both languages. At the same time, today we're going to talk about what is postpartum depression. What are the symptoms, how you treat them, and why TAL Community Mental Health Center has decided to do this. As you know, we are located in North Miami Beach, and in this area, we have a lot of individual therapy. However, we do not have groups, and that's what we bring. We're different for a lot of reasons, but one of them is because the mix between mindfulness, holistic and integrative mental health tools, but also because we want to bring the group support to our community. We're going to work with Hispanics, with African Americans, the Creole community, and also the Jewish community. So we are more than happy to have Myriam Ayala tonight. Is she around yet?
I'm looking for her. I think she joined, but we need to invite her to come in. I'm just trying to get her to be with us. Just continue talking.
She's coming with us. I want to share with you a few events we're going to start having next year. Starting in January, we already started the group of, here we go, here you are. Okay, I was going to talk about when do we start this new group. This new group is going to start in January. And Myriam, welcome. I already introduced you, however, I'm going to introduce you again. So Myriam, are you original from?
I'm from Puerto Rico, born and raised in Puerto Rico.
Okay, great. So Myriam is a licensed clinical social worker. She's a full soul human being. She speaks Spanish and English, and she likes mindfulness. As a matter of fact, she's a member of the National Association of Social Workers.
Mm-hmm.
She runs the group of support for our social workers here in Dade County. We have a lot of work, so we need support too. And Myriam is one of the awesome social workers that does her she's a volunteer there. Let's have that clear. And tonight we're gonna talk about the first group you're gonna run, which is the postpartum depression. Welcome, Myriam.
Thank you guys so much. It's such an honor to be sharing this space with you guys and to be part of TAL. I really love the agency. That's why I decided to be part of it, because I really love the commitment, not only to the community, but the fact that you guys are introducing not only the evidence-based modalities, but also all those modalities that are alternative that people have put on the side and that we have realized that they work and they help people heal. So thank you so much. I don't know what's happening with my camera, but I don't know if you guys still see me, but
Yes, we can see you.
because it goes on and off. So I'm sorry about that. So we're going to do this in Spanglish for our Spanish speaking
Yes,
clients?
I guess. We're going to do it in Spanish. Sí,
Totally
total.
I love it. I love it. We know Puerto Ricans in New York or New Yorkers are known for that. We love to do the Spanglish thing.
Bueno, pues hablemos un poquito en español. Myriam Ayala es bienvenida a TAL, es una de nuestras terapeutas profesionales. Ella es licenciada trabajadora social. Para aquellos que no saben, el trabajo social en maestría en Estados Unidos te da la oportunidad de dar terapia. Y Myriam trabaja dando terapia individual y con nosotros va a dar lo que son los grupos. Como mencionábamos antes, Myriam, TAL tiene como diferente que pues tenemos muchos grupos de support. Y como tú mencionaste, son, ¿cómo lo decimos? Evidence-based practice, son en español.
Prácticas de evidencia científica, con evidencia científica, ¿no?
Correcto, que ayudan a la parte de apoyar a la sanación de las emociones de las personas y también incluimos terapias alternativas o algunas maneras en el área del mindfulness, en el área de la meditación, que se unen para hacer todavía más efectivo la labor de TAL. ¿Es that okay?
Yes, excelente, me parece súper. Y qué bueno que mencionas lo de los grupos, porque los grupos tienen una forma increíble de ayudar a las personas porque ofrecen no solamente... ¿Aló?
Ahí vamos.
No solamente... ¿Me escucha?
Sí.
Ajá. No solamente el apoyo del facilitador, pero también el apoyo de los compañeros, de los peers, como se le llama en inglés, porque escuchamos de esas experiencias y aprendemos muchísimos de ellos. Así que el trabajo en grupo es increíble, se aprende muchísimo, se encuentra mucho apoyo y yo pienso que muchas personas pueden sanar a través de estos grupos.
Bien, vamos a entrar en materia. Let's talk about the issue.
Let's talk
Postpartum depression.
Yes. Believe it or not, postpartum depression is much more common than when we really think. 1 in every 10 women here in the United States have experienced postpartum depression, right? And the sad part is that a lot of times it goes untreated because I don't know what's going on with my phone. I apologize. The person doesn't know how to recognize the symptoms, right? Or they feel afraid to reach out for help, or they feel embarrassed because they just gave birth to a baby. How can I be depressed? I just gave birth to this beautiful baby, right? So people are scared, are ashamed to reach out for help. So a lot of times, unfortunately, it goes untreated. Una de cada 10 mujeres, afortunadamente, muchas de estas mujeres no reciben tratamiento porque no buscan el tratamiento, porque primero que nada no reconocen los síntomas y segundo, a veces sienten un sentido de culpabilidad de que se están sintiendo deprimidas después de haber dado a luz a un hermoso bebé. Entonces tenemos unos factores que contribuyen a esto.
So, Myriam, fuera de cámara, como dicen los que saben, fuera de cámara, hablábamos de que el postpartum depression puede incluir querer o pensar en pensamientos obsesivos. Like it can include like obsessive feelings or thoughts that you will hurt the baby or yourself or somebody else. This is a biggie.
Yes.
Can we express a little bit about it?
Yes, it's super important. That's very common when the person is experiencing either baby blues or postpartum depression, because there's a difference, and we can talk about that later, right? But a lot of times, these women are experiencing what is called either obsessive thoughts or intrusive thoughts. And those thoughts, a lot of times, are about hurting the baby. So what the mental health professional has to determine, or the doctor, because you can also go to your primary care physician or your GYN, the person has to determine if, number one, the patient or the mom is okay to continue to take care of the baby, right? If these thoughts are dystonic, meaning that the person knows that they're experiencing those thoughts, but they're also aware that they're not going to take action. Or if there's syntonic, meaning that, yes, I am thinking about hurting the baby and I have a plan, because then we have to take immediate action. But they're very, very common, these intrusive thoughts about hurting the baby. More so than...
Okay, en español.
Ahora en español,
Muy fuerte lo que acabamos de hablar.
Sí.
Y guárdame que tengo una pregunta después.
Listo. Ok. Desafortunadamente, muchas de estas madres, cuando están atravesando lo que se le llama en inglés los baby blues o la depresión postparto o perinatal, experimentan lo que se llaman pensamientos intrusos, y estos pensamientos intrusos muchas veces están relacionados a hacerle daño al bebé. Como, por ejemplo, he tenido pacientes que me han dicho, he pensado coger el bebé, me ha pasado por la mente coger al bebé y tirarlo por la ventana, ¿verdad? Ese tipo de pensamiento, pero yo reconozco que es un pensamiento y yo nunca le haría daño a mi bebé. Entonces, de esta forma se descubre que el pensamiento es dystonic. No sé si en español sería distónico, ¿verdad? Estaba buscando la terminología en español, pero la persona se siente incómoda con el pensamiento, eso sabemos que no va a actuar. Sin embargo, hay personas que sí tienen hasta un plan, que se sienten no necesariamente cómodos con la idea, pero lo han pensado, el pensamiento es muy recurrente y quizás hasta han elaborado un plan para hacerle daño al bebé. Y en estos casos es importantísimo que lo notifiquen, porque quizás tendríamos que retirar el bebé de la mamá por un tiempo en lo que la mamá obtiene tratamiento.
Y si, wow, o sea, Myriam, me hiciste pensar en cuando yo tuve mi hijo, él tenía como 3 años y yo sentí en un momento ganas de hacerle así. Claro, me sorprendí y salí corriendo.
¿Viste lo que acabas de decir? Súper importante. Tuviste el pensamiento, pero inmediatamente te sorprendiste y dijiste, no, ¿cómo me ocurrió esto? ¿Cómo se me ocurrió esto? ¿Cómo me pasó esto por la mente? Entonces ahí te das de cuenta que es distónico, porque no está de acuerdo a lo que tú estás sintiendo como mamá, que es amar a tu bebé.
No es un plan. Gastón, tú tenías una pregunta.
Yes, I'm going to switch to English so we can go back and forth. But So my question is the postpartum depression specifically just for the mom who just was carrying the baby, or there is any type of, you know, carry
Postpartum for
over
the
to a little
father.
bit, you know, to the husband, or even to older kids or older siblings. I don't know if it's just really for the mom because was carrying the baby, or anyone else who is in the house as well.
I think other people in the house can experience some kind of disorder, mental health disorder. It could be anxiety. It doesn't have to be depression. Some people have postpartum anxiety. Some people have postpartum psychosis. But I think the postpartum depression has really been diagnosed. Women have been diagnosed with postpartum depression. I don't know if men, and that's something that I have to look that up. That's an interesting question. But people do experience other disorders like postpartum depression, postpartum anxiety, postpartum psychosis, right? So there's different mental health disorders when after a baby is born, and they can be experienced by different family members.
Well, as a matter of fact, there's always certain difficulties when there are siblings, and especially if there are three siblings, then it becomes like the baby, the older one, and the middle one. So yes, always it's usually develop different dynamics within the family, just the presence of the new baby.
Mm-hmm.
So that's the reason why we decided to open this kind of group, because it not only touches the mommy after she has the baby, but also touches the whole family.
Mm-hmm.
And that's the reason why, Myriam, let's talk about it. Let's talk about a little bit of how do we treat that? I mean, I'm having these thoughts and I don't want to tell anybody because I'm afraid people look at me like I'm crazy.
Mm-hmm.
And how do we treat postpartum depression or anxiety? How this works? ¿Cómo yo busco ayuda?
Mm-hmm.
Cuando ya yo tengo estos pensamientos, estos sentimientos, no quiero contarle a nadie, tengo mucho miedo porque me van a decir que estoy loca.
Mm-hmm.
¿Cómo se trata este tipo de situación?
Ok, como acabo de mencionar, no solamente es la depresión postparto, sino también ansiedad postparto o psicosis postparto. Entonces creo que es importante que las personas aprendan un poquito de qué es lo que las personas experimentan que se pudiera atribuir a un desorden mental. Por ejemplo, una mamá que acaba de dar a luz y se siente fatigada todo el tiempo, se siente con dificultad para dormir, se siente irritable, tiene este tipo de pensamientos intrusivos de los cuales abordamos o hablamos ahora mismo, tiene dificultad en conectar con el bebé, lo que se le llama bonding, ¿verdad? Tiene pensamientos persistentes de que no es una buena mamá. Ya todo esto nos indica que la persona pudiera estar experimentando o ansiedad o postpartum depression, right? Postpartum anxiety o postpartum depression. Entonces, una vez la persona identifica esto y va a pedir ayuda, pues esa persona va a trabajar o en grupo, como T.A.L, o va a trabajar individualmente con un terapista que va a trabajar con este tipo de sintomatología que está experimentando. Si la persona está experimentando depresión, pudiéramos enseñarle quizás a identificar los pensamientos con el triángulo cognitivo, ¿verdad? Donde identificamos los pensamientos y a dónde nos llevan estos pensamientos y cuál es el comportamiento. Pudiéramos utilizar ese tipo de terapia. Si la persona está sumamente ansiosa, pudiéramos implementar modalidades como la meditación o el mindfulness, ¿verdad? Que son prácticas que se enseñan en T.A.L. So, dependiendo de la sintomatología del paciente, va a ser el tratamiento, pero puede recibir terapia individual o terapia en grupo.
Ahora, let's try to summarize in English because I guess we went too much in Spanish.
Okay. We're gonna go back to English. Mm-hmm. So first of all, we have to determine the symptoms that the person is experiencing, right? So if the person may be fatigued, may feel overwhelmed, may have difficulties bonding with the baby, right? May have a lot of thoughts, persistent and intrusive thoughts, right? That are ego dystonic, that doesn't make them feel good. that are in relation to hurting the baby. So if a person is experiencing any of the symptoms, they should really reach out for help. And once the person is working with either a psychiatrist or mental health provider or social worker like us, then we can work on a plan and see how we're going to help this person. It could be individually, like individual therapy, or it could be in a group setting, like we talked about. And there's different modalities, mindfulness-based therapies, cognitive behavioral therapy is very, very good to treat postpartum depression.
Let's say just one right there. What is cognitive behavioral therapy? So you have a thought, and then this thought takes you to a feeling, and then this feeling takes you to what you want to do with that feeling.
A behavior.
A behavior. So when the therapy consists in helping you trying to realize those thoughts and take care of them in a different way. Let's talk about how the curriculum, we talk about the curriculum, how it's going to be the curriculum of the group. ¿Qué vamos a poner ahí en ese grupo? ¿Qué vamos a hacer con él?
Ok, nuestro programa va a comenzar la segunda semana de enero, el 11, creo que es el martes 11 de enero, a las 6 de la tarde, de 6 a 7. Y va a ser un grupo de apoyo para cualquiera de las mujeres, o bueno, si hay algún hombre que quizás la pareja no quiere venir al grupo, pero él sí quiere venir porque quiere apoyar a su esposa, también puede ser parte del grupo. Y lo que vamos a trabajar son toda esta sintomatología de lo que es el Postpartum Depression o la ansiedad postparto. Vamos a trabajar con la modalidad de Cognitive Behavioral Therapy, terapia conductual, y también vamos a trabajar con el manejo de las emociones, emotional management. Vamos a trabajar con el mother-baby bonding, that is super important, because unfortunately, when there is postpartum depression or anxiety, moms have a hard time connecting with their babies. And that is so crucial, Marcela. It's crucial for the mom, and it's crucial for the baby. And for the baby. Yes.
Because they do actually, human beings have, when you go to these other tools, regressions and things like that, they find out that they were in some way rejected by their parents when they were a baby. It does bring consequences in their emotions when they become adults. Absolutely.
For sure. So we're doing mother-baby bonding.
Bonding?
Yes, we are doing relaxation, self-care, and stress management. So, and of course, the support not only from the facilitator, but also from your peers, listening to them, listening to their stories, and learning from them.
So I have, today while we were sharing, the post that we're going to have this live today, and thank you so much, Myriam, for being with us. And I got a WhatsApp message that said, this is from a male person, and says, thank you so much for bringing this setup because it's very important. I had a classmate from college who committed suicide, and she didn't realize she had postpartum depression.
It's so sad. That's what I mentioned earlier. Thank you for bringing that up, Gaston, because unfortunately, a lot of women go through postpartum depression, but they don't really know that they're going through that. And there's so many changes, not only emotionally, but physically. Our body goes through so many give birth. And I say we because I have a baby, right? I have a 22-year, not a baby, I have a son. I have a 22-year-old son. And I recall going through the process. It was very difficult. There was a lot of changes. Your life changes completely, especially when it's your first one. And if you add to that risk factors, I don't know if we talked about that. Did we talk about risk factors?
No, not yet.
Yes. And if you add to all those changes and, the body getting traumatized from giving birth, whether you are natural birth or you have a C-section, your body goes through trauma, right? And then you have risk factors like financial constraints, right? Marital stress, being your first child, lack of support, all those things can really add to developing postpartum depression. So we have
even those, I'm sorry to interrupt you, even those that are sometimes that are too young and they got the baby, they ended up having the baby even though they're too young, and so they have all this, they are overwhelmed with the responsibility. This is the kind of mom that really needs help, the teenager kind of young adult mom, because they really don't know how to deal with themselves first of all, and now they have this new little baby trying to, if you know, they have to feed him and they have to do all this stuff. Yes, that's one of the most I experienced myself in the past with some of my patients, that kind of depression, especially those that are young adults.
Yeah, it's very difficult. Your life changes completely. It doesn't matter. Even if you have support, your life is going to change, right? So it's very important that people recognize their risk factors and the symptomatology. If you're not feeling okay, if there's something off, reach out for help. Talk to either a friend, a family member, a mental health professional. If you don't feel comfortable reaching out for mental health services right away, speak to your doctor or speak to your GYN. But make sure you speak to someone, because there's someone willing to help you. There's always someone out there that wants to make a difference and wants to help. But it's important, because if you don't reach out for help, you will never know if you actually have postpartum depression. And some people just have baby blues, right?
What is baby blue? What is the difference between baby blue and postpartum depression or anxiety?
When we have a patient with baby blues, it's usually like a sort of like a mild depression. You're going to see some symptoms, but they're very, very mild, number one. And number two, they tend to go away over the span of about 2 weeks. When you have postpartum depression, you know, you're more likely to experience symptoms for a longer period of time, right? So we're talking about 6 weeks or more, experiencing symptoms of depression. And another thing that is important to note is that a lot of people have been experiencing depression prior to the pregnancy, and then the pregnancy and labor triggers all those symptoms of depression, right? So most likely the person was experiencing some kind of depression or anxiety in the past, and then after the pregnancy, all those symptoms got exacerbated.
So, okay, so in some way having the baby is a trigger.
It's a stressor, yes. It's an added stressor, and then that's like a trigger, are you saying?
Now, so I was a father too, you know, of a little one, and two actually. And what I recall, lo que me acuerdo es perfectamente es que no solo todos los cambios de lo que estás mencionando y todo lo que le pasa también a la mujer y el postpartum depression, pero también hay como hay una situación que cambia también en toda la casa, incluso en la pareja, sin duda. Especialmente creo que nosotros como maridos o como esposos, creo que también nos sentimos como que a un lado. Por eso decía, tal vez que también nos puede coger a nosotros alguna cosita, porque nos sentimos como aislados, nos sentimos como que ahora los hijos son más importantes, y nosotros pues como que perdemos a la mamá, a los hijos, perdemos como toda una noción de quiénes somos, cuál es nuestro papel en la casa, y qué pasó con el romanticismo también de la pareja.
No sé, Myriam, no sé si hay un nombre para ese sentimiento de la pareja. O sea, sí, es muy real, es verdaderamente, es siempre o prácticamente siempre ocurre así. El hombre se siente ignorado, pero no creo que, yo creo que debe haber un support group for baby. I don't know how to call it. Let's talk about it.
Yeah, we're going to talk about that. Pero me encanta, Gastón, que estás trayendo la perspectiva de un hombre, porque no sé si afortunada o desafortunadamente, esto del postpartum depression, pues casi siempre se ha tratado con las mujeres y los hombres se han hecho a un lado. Y los hombres sí experimentan todo esto que tú estás mencionando. O sea, se sienten rezagados, que la esposa quizás ya no le da la atención porque no puede a veces, porque está ocupada con el bebé, ya no está esa intimidad, ¿verdad? Y todas
la intimidad se empezó a perder incluso en el embarazo.
Exactamente.
Para muchos. Okay, wait a minute. Gaston brought to the table, just in English, Gaston brought to the table that men also have issues when the babies are born. They are ignored. They feel like nobody's taking care of them, and how this can be fixed if it has a name, even. So Myriam is now answering.
I'm actually going to research that, but I don't know if you will come to see a clinician and they will give you a diagnosis of either postpartum depression or postpartum anxiety. But those points that you're making are very important and very relevant because men do feel that way, right?
Yes, they do.
During pregnancy and even after pregnancy, some men feel very uncomfortable having sex with their partners when they're during pregnancy. I have heard that in my practice, right? And then all those things that you mentioned that are very real. They feel displaced, they feel they don't have any intimacy, and this can lead to depression, even feelings of low self-esteem because you're like, oh, wait a minute, what's going on here? There's something wrong with me. Did I do anything wrong? Am I not performing? So a lot of things can come up. So it's something to address. I love it. I love it.
No, and unfortunately, in cases that I know, as I was a clergy and I got to meet a lot of people too, and that unfortunately might even lead to cheating because if they don't have it at home, they might look outside. So it brings a lot of sort of problems, that just for not taking care of it, not that they can take care of it. That's why we are here. That's what Myriam is here. That's why Marcela is here. That's what T.A.L is here, to really help you out, to help everyone in the society in the different areas. And like this, we're talking today about postpartum, but nobody realized that actually that the husband or the partner, is also having some issues that we can also help out. And we might need a second group for that.
Exactly.
Bueno, importantísimo lo que menciona Gastón, para aquellos que hablan español solamente. Gastón menciona, estamos hablando sobre el Postpartum Depression. Este es un live patrocinado por TAL Community Mental Health Center. Es una institución que une ambas, tanto la manera de tratar las circunstancias, la sanación de emociones a través de evidence-based practice, prácticas de evidencia científica, y también aquellas que tienen que ver con el mindfulness, el movimiento, la música, para apoyar al ser humano a sentirse mejor. Estamos hablando sobre el Postpartum Depression y Myriam, quien es una terapeuta licenciada en el estado de la Florida y en Nueva York, hace parte de nuestro equipo, y estamos hablando del grupo de postpartum que empieza en enero. Y lo que trae Gastón, habíamos hablado de los síntomas, que las mujeres, que pobrecitas, y viene Gastón con su bandera y dice, ¿y nosotros qué? Que no nos quieren, que nos ignoran, que ya no tenemos sexo como lo queríamos antes. Desde el embarazo la cosa se baja y encima de eso muchos empiezan a sentir las ganas de ser infieles, y de hecho es muy común en la comunidad latina que el hombre termina buscando una tercera persona para desahogar su libido mientras la mamá vuelve a su estado natural. Y bueno, eso es un tema que ya se vuelve family therapy inmediatamente.
Sí, estamos hablando de otro tipo de terapia, pero es importante mencionarlo porque una de las cosas que hay que hablar en estos grupos es la importancia de tener ciertas conversaciones que a veces resultan ser difíciles, y quizás dejarle saber al esposo, mira, yo sé que quizás no me siento con el entusiasmo, las ganas de tener tanto sexo, pues porque estoy cansada o porque no quiero, pero dejarle saber a la pareja y buscar formas de cómo se pueden satisfacer el uno con el otro, ¿verdad? Entonces es importante. Qué bueno que lo mencionaste, Gastón, porque siempre quedan como que rezagados los hombres en esta parte del postpartum. De hecho, esto añade presión a la mujer, especialmente la mujer latina, que idealizan el rol de ser mamá y todo tiene que ser perfecto. Ajá, y entonces, ¿qué pasa? No tenemos que ser perfectas y está bien si estamos pasando un momento difícil, si nos sentimos deprimidas en algún momento dado después de dar a luz, si nos sentimos ansiosas, si hemos tenido algún evento de psicosis. Es importante reconocer que está bien, que puedes tener ayuda y que puedes ser mejor.
En los grupos van a ser presenciales. Algunas personas si necesitan de utilizar el Zoom, también es importante que lo vamos a tener disponible. Estos son grupos que no van a, tú para entrar al grupo no vas a necesitar tener un diagnóstico y si lo tienes, pues no los es importante que nos lo dejes saber. Si estás experimentando este tipo de síntomas que ya mencionó Myriam. O sea, creo que alguien está haciendo una pregunta.
Sí, mira.
No entiendo nada, pero en español podría explicar cómo. Forget it. Eso parece que entré desde mi portal de validación de títulos, donde hay 10,000 seguidores y están haciendo preguntas del tema de validación de títulos. O metí la pata, debía haber entrado por otro.
Ajá.
Pero este grupo va a ser en inglés, pero o en español. Yo creo que ahorita tenemos, por ejemplo, uno de padres en TAL y nos vamos al inglés y al español todo el tiempo, porque eso es what we are. I mean, eso es what we are. Estos grupos, las personas pueden llamar, Gastón, ¿a qué teléfono pueden llamar? ¿Cuál es nuestro website?
Sí, yo estoy escribiéndolo todo el tiempo allí, pero pueden llamar al 786-648-358-786-648-3588. If you need to go to the website, tienes que ir a la website, es www.talcmhc.org. En español es www.talcmhc.org.
Yo me duermo. Con TAL Community Mental Health Center. Lo importante, quiero hablar en español un momento, ya que me metí la pata y me metí por el de español, el profile de español. Número uno, este es un centro de apoyo emocional para sanar las emociones. Y número dos, para los que nos están viendo, que quieren saber de validación de títulos, también va a haber un grupo para ustedes, los inmigrantes, las personas que necesitan de trabajar las emociones que significan dejar su casa, su profesión y su vida. Más adelante estaremos hablando de este grupo en el mismo tal, arroba valida tu título, a los que nos están viendo ahora. Yes, I'm sorry, Myriam, I had to say it.
No, that's awesome. Es importante que las personas sepan todos los servicios que hay disponibles en TAL, porque no solamente son grupos de Postpartum Depression, ahora mismo estamos corriendo un grupo para padres, y eso que acabas de mencionar pudiera ser un risk factor para que la persona experimente un Postpartum Depression. Mudarse de su país, dejar su entorno, su familia, su profesión, todo eso puede crear mucho estrés, puede crear a algunas personas depresión, puede resultar en una depresión, en una ansiedad. Y entonces estas personas quizás pueden estar más propensas a desarrollar lo que es un postpartum depression si están aquí y dan a luz aquí en este país.
Sí, de eso es una de las cosas que yo les digo siempre. Ok, validamos el título, pero apenas vengan, por favor, esperen un tiempito para quedar embarazadas y hace parte del proceso de la salud mental de la persona. La gente cree que es jugando, pero no.
No, no es jugando. Y si se dan cuenta, ustedes dos estuvimos hablando del tema de postpartum y estuvimos hablando también del tema de lo que puede llegar a pasar con la pareja. Estuvimos hablando ahora, o sea, porque daba el caso hablar sobre el tema de inmigración y lo que significa mudarse a ser inmigrante. Y sin duda estamos dando un grupo que va a empezar también en enero, que es el de Grief and Loss, que es sobre el tema de duelos. Y el duelo no es solamente cuando has tenido la pérdida de un ser querido, sino que el duelo puede ser, perdí a mi esposa, perdí de alguna forma, o sea, este momento de intimidad, perdí obviamente mi país, mi lenguaje, mi comida y mi lugar de apoyo y mi sistema de apoyo, y ahora estoy en otro país. El duelo, para que todos sepan, cuando estemos hablando del duelo una vez más, no se trata solamente de tener a alguien que perdimos, que pasó del otro lado del canal, sino que tiene que ver también con haber tenido una pérdida específica.
Myriam, algo más que quieras añadir? Something else that you want to add in terms of what we are going to experience on next January?
So I just want you to know, if you're listening to this video, that the group is really aiming to support its participants in any way possible, right? Not only the support of the facilitator, but also the support of the peers. We want to support, we want to give you tools, not only support you, but we want to give you concrete tools so that you learn how to deal with this situation. We want to also give you tools on how to bond with your baby. We want to give you tools for self-care. And we want to give you a very, very safe space where you can come and share how you feel. That's really the purpose of this group. Ahora en español. Queremos ofrecer un espacio confidencial donde tú puedas venir a contarnos cómo te sientes y a procesar tus emociones. Queremos que te sientas apoyada durante este tiempo de una etapa de cambios, ¿verdad? Queremos también darte herramientas y enseñarte habilidades para que aprendas a manejar el estrés que conlleva el ser una nueva mamá o el ser una mamá, porque quizás tienes otros niños, ¿verdad? También queremos darte herramientas para que aprendas un poquito más sobre el autocuidado, que es tan importante durante este proceso, y que también aprendas a validar tus emociones y a entender que el proceso de tener un bebé, pues, puede ser un gran reto.
La mayoría de las mamás latinoamericanas y las mamás pensamos que necesitamos ser, como tú dijiste, perfectas. Te invitamos a que participes en estos grupos de apoyo. Estamos localizados en North Miami Beach, 1400 Miami Gardens Drive, la suite es la 216, y allí estamos mi esposo, quien es Gastón Bogomolny, clérigo de la comunidad judía. Mi nombre es Marcela Gómez Bogomolny, trabajadora social, experta en validación de títulos y terapeuta. Y también está con nosotros Myriam Ayala, quien es terapeuta de origen puertorriqueño, habla perfecto inglés y español, licenciada en el estado de la Florida y en el estado de Nueva York. Gracias por estar con nosotros. Thank you very much for being with us tonight. It was Myriam Ayala from Puerto Rico. She is licensed in the state of Florida and also in the state of New York. Gaston Bogomolny, clergy Jewish from the Jewish community, and myself, who is Marcela Gomez Bogomolny. I'm a social worker, and I've been an expert in validación. I don't know how to say that in English, validation, of 40 trained professionals degrees. Also, I've been a case manager and a therapist for a long time already. So here is a team, part of the team of TAL Community Mental Health Center. If you really need help, if you think that you may need assistance, we're here to help you. These support groups can also be taken by Zoom, and we're licensed in the state of Florida. Thank you very much for being with you, and have a good evening.
Thank you. Thank you for having me, guys. See you soon.
Thank you.
Okay.
Thank you, Myriam.
Take care.
Un abrazo, Miri.
Igual
Happy
para
holidays,
todos.
everyone.
Happy holidays.
Happy holidays. Bye.